Hey, what's up guys? It's me, the PsychNPDavidC. So chances are, if you're watching this video, you're probably an RN thinking about becoming an NP. And I get asked all the time, like, what's the difference between working as an NP versus working as an RN? So I worked as a Psych RN for 6 years before becoming a Psych NP, and the difference in job responsibility is massive. It's not just a difference in pay. You have a lot more responsibilities, your mindset changes as you're working, and people just see you differently in general. Let's talk about it. So first, let's compare the clinical role between the two. As an RN, your main focus is just carrying out the plan of care. You assess patients, give meds, provide interventions, and act as advocates for your patients. You can think of yourself as basically the glue that's holding everything together. But on the other hand, as an NP, you're the one who's actually creating that plan. You're the one who's diagnosing, prescribing, and making clinical decisions. So for example, if you're working as an RN and you notice one of your patient's vital signs are trending downwards, you just notify the NP or the MD, and then you let them make the decision as to what to do. But on the other hand, as an NP, you're the one who's actually deciding what to do in those situations. For example, since I work in psych, as an RN, we usually call the doctor if one of our patients is acting aggressively, and then the doctor will decide which kind of medication to give them. But if you're the psych NP, you're the one who makes that decision. Like, do you give them Haldol, Ativan, Benadryl, Zyprexa, Geodon? You have to be confident enough to make those decisions. And that leads us to the next part, which is responsibility and pressure. This is probably the biggest change from being an RN to becoming an NP. As an RN, you kind of just escalate your concerns to a doctor, and then you let them handle the decision making. But as an NP, you're pretty much that doctor. Like, you're the one who's signing your name under those orders. If you order a certain medication and a certain dosage for a patient and they have like an adverse reaction, then it's probably gonna be on you. And then you have to figure out like, how do I fix the situation? What do I do next? And you have all these nurses waiting on your decisions. So as an NP, you have a lot of power, but with great power comes great responsibility. When you're working as an NP, you're definitely going to be second guessing every decision that you make. Over time, you'll build more confidence, but the responsibility is always there. And the next difference is workflow and pace. As an RN, your entire day pretty much revolves around your patients and what they need. You're pretty much always hands-on, right at the patient bedside, always on your feet, walking around. But as an NP, it's different from that. Your work as an MP is often more just decision-making and documenting. Like, yes, you still will see patients face-to-face, but you're gonna spend a lot more of your time documenting. We document using the SOAP note format. In SOAP, the S stands for subjective. So this is basically what the patient is saying to you. Are they saying things like they're having trouble concentrating, trouble with their appetite, trouble sleeping? Basically anything that you can't really see, but they say. And then the O stands for objective. So this is what you do see on the patient. Like, what's their facial expressions? What's their affect? How's their speech? Is it normal? Is it tangential, circumstantial? Are they barely speaking to you at all? And then A stands for assessment. This is pretty much where you explain what you've seen. Like, you could say something like, patient remains isolative, withdrawn, poor appetite, meets criteria for major depressive disorder, something like that. And then P stands for plan. What meds are you going to prescribe? What's the dose? What's the timing? How many refills do they get? When should they see you next? So as you can imagine, doing a full SOAP note for every patient is very time consuming. So in a sense, you get a lot more autonomy, but with that autonomy comes a lot of charting. In general, I would say I spend about 20% of my time with the patient actually talking to them, and then the other 80% documenting. Yeah, it sounds counterintuitive, but that's actually how it works for the most part. And then next up is just how other people treat you. You know how they say you should treat everyone with the same level of respect, no matter if they're like a CEO, a nurse, a janitor? So that's what we'd like to think happens, but it actually isn't what happens all the time. Honestly, I don't go around flaunting the fact that I'm an NP. I don't wear these scrubs at work, I just wear them for my videos. Because I find that sometimes when someone finds out that I'm an NP, they actually treat me differently. Like, they'll go out of their way to give me their chair if there's no other chairs or something. But if, let's say, another nurse needed that chair, they wouldn't be so quick to offer up their chair. It's not always a bad thing, but yeah, when people figure out that you're an NP, they kind of put you in like an upper tier. It feels weird at first, but after a while, you kind of just embrace it. And the last part is just how much you have to use your brain. Now, I'm not saying this in a toxic way, but as an RN, you definitely don't have to think as much than if you were an NP. As an RN, you kind of just have things you need to do and you already know how to do those things. For example, let's say it's 8 o'clock in the morning and you're starting your med pass. You see this patient is on Lexapro 10 milligrams daily, so you grab the Lexapro and you go give it to the patient. And then you complete your assessment on the patient while you're passing their meds. And then you document that you gave the med and you document your assessment. It's very routine-like. But as an NP, there's a lot more cognitive load. You're constantly having to problem solve, make judgment calls, and just think ahead. Like, for example, let's say you have a new patient who's like a 36-year-old female, comes in during a manic episode, but is also hearing voices. You first have to find out if they're like bipolar with psychotic features or just schizoaffective. And then you have to figure out which medication you want to prescribe. Do you want to try Zyprexa first? Do you want to try Seroquel first? Risperdal, Abilify, and then the dose and the timing of that medication. Honestly, a lot of that decision making can actually make you mentally drained at the end of the day. Like, real talk, as a psych RN, I barely had to think about anything. Maybe that's because I have 6 years of experience, but regardless, as a psych NP, I have to make so many more decisions and I have to use my brain a lot more. So in the end, is it better to be an RN or an NP? The answer is it really depends on what you're looking for. If you're looking for a job that's like more hands-on, more routine, less liability, less responsibility, less decision-making, then I'd probably say RN is a better fit for you. But if you want more autonomy, you're confident in your decision-making, you're okay with using your brain a lot, like literally every minute, and you'd like a little bit more pay, then NP is probably better for you. For me personally, I do not regret becoming a psych NP. Yes, there's a lot more responsibility and liability, and I have to use my brain a lot more, but the autonomy and the slightly higher pay makes up for it. One job is not better than the other, it really just depends on what you want. If you have any questions about RN versus NP, let me know in the comments down below. If you found this video helpful, make sure to like and subscribe. I am also on TikTok and Instagram if you want to follow me over there at ThePsychNPDavidC. I do telehealth medication management for adults living in California. If you're interested, there's a link down below. And with that, your mental health just leveled up. You're welcome.